You can't fix what you don't measure, and functional medicine allows us to measure everything. I get asked a lot, what is functional medicine? And it's a great question. It is, I like to say, the marriage between conventional medicine and what that offers us and the deeper investigation of what is causing the complaints that the patient has. It is that forensic analysis that allows us to dive deeper into addressing those causes of the symptoms that you're presenting with. As an example, you might come in and complain, I have diminished energy, I feel fatigued, my hair is thinning. And so instinctively we might think, oh, maybe it's something with the thyroid. In traditional or conventional medicine, routinely maybe a TSH is done and maybe a free T4. Whereas when you come into a functional medicine realm, if you will, we start looking at so many more things. We're looking at how your adrenal glands are functioning, your stress hormones, your free T3, your reverse T3, what's going on with your liver? Are you converting from T4 to T3 well? There's just a much deeper analysis and a lot more time that goes into configuring your treatment plan and also determining those diagnoses that you might be having. I have been asked, what is maybe the issue with conventional medicine? Why does it seem to be such a hot topic right now? We have things changing within government with regard to our health and our foods. I think that the bigger issue with conventional medicine, if you will, is it seems to be very clinical guideline based. So in other words, it's kind of removing the forensic analysis or that deeper investigation that we really should be doing. And I'm not canvassing everybody, and I'm not saying that that's the case with every provider at all, but I am saying that it tends to be because of the constraints of both commercial insurance, right? Our plans that we buy, that we pay all this money for every month, we're constrained to a 10-minute visit with a patient. And you barely look up and you're writing a prescription and you're sending them on their way. When we work into functional medicine, because most of them are cash pay and they don't take out health insurance, your provider has a lot more time to do that deeper diving, to do that really advanced testing, and to forensically analyze everything that's going on from your brain to your toes. And when you're in that conventional model, it's very symptom driven. You come in with a complaint, we make a differential diagnosis as to what we think that you could possibly be dealing with, and you're sent on your way with a prescription. It is not modeled as a very patient-centric approach. And I really think that the bigger difference between the two comes down to that patient-centric approach and the time that you invest with your patient and trying to uncover the causes of what they're experiencing. So when I onboard a new patient that comes into the practice, it's always going to start with, I always call them the 3 basics. They're going to do genetic testing, they're going to do urine and saliva testing, and then they're going to do some blood testing for me. The reason why genetics, I have had people like, why do you do genetic testing? Because the genetics never change. If I determine that a patient has some significant issues with their detox pathways, that's never going to change. So those supplements that they're going to start to take as a regular part of their routine are never going to change because they'll always need support there. The urine and the saliva and the blood, those things can ebb and flow. Somebody could maybe show that their free T3 or their free T4 was suboptimal. Well, that can change with time, but the genetics will never change. So that's a huge part of my initial onboarding process. Of course, then they fill out, it's almost like a 13-page book, but we go through a detailed health history because we're looking at diet, we're looking at exposures, we're looking at lifestyle habits. You have to take all of those things into consideration when you're doing your workup for your patient because lifestyle affects outcomes tremendously. And you really don't want to be throwing things at a patient if, for instance, their weekends, they're binge drinking. So dietary, sleep habits, workout habits, all of those things really matter as much as the testing. When you first enter the functional medicine world, you'll start to hear so many different terms that can be a little overwhelming. So I'm going to break down some of them as best I can for you, and probably the more common ones that I use with my patients. The first one is root cause, and that's the why behind everything, right? Instead of coming in and you're reporting you're tired, I'm going to try to figure out why you're tired. What's not working well and why isn't it working and how can we fix it? So like I said, root cause kind of takes me back to my law enforcement days of being an investigator, because it makes me look at everything. And that's the beauty of this realm of medicine. The next one, of course, is always going to be HPA axis, right? And I always say that's like the motherboard of the body. It is literally your stress control center and gives us the blueprint for so many things that we need to do. And you'll always hear me say everything is connected, and that is because of that axis. Everything is interconnected. High stress affects every part of your body, from your brain to your toes. Your next common one that you're going to hear is methylation, and it is so important because it is a part of that incredible phase 2 of your liver, how it works, that detox pathway. When your methylation's slow, or it's sluggish, or you're not clearing things, you feel that. You feel that in your brain, you'll feel that in your body, in your gut. It is absolutely imperative that that system is working. So it's a hot topic word you hear across the board in functional medicine, but it's probably one of the most important elements of your body's health. The other one you're going to hear us talk about a lot is mitochondrial function, mitochondrial health. I talk a lot about mitochondrial dysfunction because that's what starts to happen as we age, and the things that we're exposed to and how they can really severely impact our mitochondrial health. Because remember, that's the powerhouse of the body, right? ATP, our energy, it's what gives us the get up and go. And if you don't have properly functioning mitochondria, you have cellular dysregulation, you're just unwell. So truthfully, any part of a program is going to be addressing your mitochondrial health and, of course, testing for your mitochondrial health. So this is just some of the small parts of the blueprints for functional medicine. I mean, truthfully, I'm really kind of glazing over a lot and generalizing because it's really so much more detailed than that. I'm curious if you guys have any questions, thought processes. Let me know what you think about the world of functional medicine and if it's something that you're interested in.